talking about the different impacts of common diseases on minority populations. What are some of the most common diseases that we see impacting minority populations?
So for the minorities, first of all, the problems that we see, their diagnoses are going to be the same ones that we see across the board. So number one, heart diseases. Number two, high blood pressure, high cholesterol, obesity, diabetes, kidney disease, and clearly I cannot stop there. Breast cancer, prostate cancer, and lung cancer, and colon cancer.
Why is it so important to talk about these illnesses when it comes to minority populations?
So that is a really good question, Katie. I'm so glad that you brought that up because this month, this theme for the minorities' health is that be the source for better health. In other words, looking inwards. In other words, starting with us. So we are improving health outcomes through our cultures. The second thing is through communities and of course through connections. And so having said that, I want to delve into a little bit about these diseases. We do know that the diseases that I mentioned are more prevalent or affect minorities more because of a few things. Number one, some of these diseases are very insidious. For example, high blood pressure. High blood pressure doesn't have symptoms. So most of the time, people are walking around with high blood pressure numbers and they show up at the doctor's office only when they have a stroke, kidney disease, or they already have a heart attack. So that is one of the reasons why this is affecting the minorities more. Second is access. So access is not just because they can't get to the doctors, but also lack of knowledge. We need to educate our communities more, tell them about these silent killers, some of these symptoms to look at, and also to have access so that the areas that we don't have clinics nearby, we can be able to have clinics in those areas so that patients can be able to access that. And also, we do know that most people do go to see clinicians who look like them or who they feel will understand them. And so having that diversity also helps different minorities to access healthcare. In fact, if you look at Baylor Scotland-wide health system, we are a very big system. One of the ways we are bridging that is by one, having virtual visits so that patients can reach us through that, telephone visits, but also building clinics in different communities in different areas. We were talking with our CMO, Dr. Seth Sullivan, about the outreach that we have in our system, and we try to also pair our patients with a physician that is fit for them. So because we are a large system, we try to fit the patients with them, match the patient with a doctor that fits with them, that way they can have access, feel comfortable coming in.
What are maybe some diseases or health issues that men and women specifically face? I know you listed a few that people in general face.
Yes, so let's talk about men, for example. Again, you're going to have heart disease, high blood pressure across the board. We've noticed that colon cancer is becoming more prevalent even at a young age. And with men, we have to think about prostate cancer. And that is real, and that is also becoming more and more prevalent. Women, apart from, of course, heart disease, obesity, high blood pressure, heart disease, we have to think about breast cancer. And I want to say again to remind people that the age for doing mammogram was lowered to 40. So every woman who is 40 and above now has access to go and have a mammogram.
And you kind of touched on this, but what are some ways that people can be proactive in making sure that they're taking care of themselves and getting checked for things like these?
So first of all, it begins with the theme that we said for this year, which is better health, starting with you. That is the individual. So first thing is going for having the screening. So go to your primary care doctor so that they can do the screening. Go to your community clinic if you don't have a primary care doctor. Follow up with your primary care doctors. Follow up with the specialists. Healthcare doesn't have to be scary. We are here to guide you, we are here to help you, and we are here to, it's good to go to a doctor who knows your history, your medical history, your family history, your community health problems that can guide you. So it's just as I said, by at least show up, we can guide you, we can help you with the screenings. Please do the follow-ups and we will help you with that.
I think those are all our questions.